I'm often asked, Wesley, how do I help people who are suffering? And I think that's a great question because it reveals an intent to learn and gain understanding and wisdom of how to be the right person for a person that's hurting or in pain. But I also think that many of us are flooded with anxiety and internal questions when we come along somebody in pain. It's not the most natural thing to engage with. Questions like, how should I approach them? What should I say? Will I say the wrong thing? Is it okay to text them or should I call them? Should I show up their house unannounced? How often should I check in with them? Maybe I'm the wrong person for this. A lot of people feel intimidated because they're not an expert, or some people, they may feel awkward because they have no idea what to say or how to engage. And most of us have never been taught wisdom and tools to navigate conversations and relationships with people in pain. So today I'd like to talk about, one, how to help people in pain, and then two, how to find help for somebody who is in pain. On the second question, we're going to lean on you guys. You two are therapists, doctors, experts, people that I respect deeply, and you're both very brilliant in what you do, and you do it so well. It's a gift from God. But I'd like to start with, how can a person gain wisdom and tools to help other people in pain? Probably the top question I get on a consistent basis around human suffering. So, Jason, what are your thoughts as you just begin to think about that question?
Yeah. Well, first of all, I love that people come to you and ask these questions because that demonstrates a desire to want to be there for other people, to care for them deeply. So I think the starting place for this is have care and concern for people.
That's great.
Begin there.
Yeah.
If someone isn't asking these questions and they're a believer, I would be concerned because we should have a concern or desire to bear one another's burdens. So I definitely think that looking to Scripture to see what the believer's responsibility is to care for others is high on the list. If you want to just do a easy exercise, go on Google and type in the one another's in Scripture and read the 40 or 50 that Scripture requires of us to love one another, care for one another, bear one another's burdens, and all of these things. I think Scripture sets a foundation. But I also think that there are some resources and places you can go to find out how to better care for people. And this might sound like a plug for us, but it is. Better Days on your website. I think you provided a lot of resources over the years to help people learn how to care for others.
Yeah. And I just recently wrote an article, How to Help People Who Are Suffering. And it took me a while to think through this, but I thought, what are primary approaches and secondary approaches that people utilize? They're like default responses to people in pain. The primary approaches are the most important ones. That's what our first response should be. And my list of primary approaches are this: presence. People need presence. Show up when somebody is suffering.
Let's say something real quick about showing up. When you show up, you don't even need an agenda. You don't even need to know exactly what to say. Showing up is literally just being present with the person. And that can be intimidating because you think, like, oh my gosh, they just experienced loss. If I go to their house, what do I do? Just be there. Be present. Literally be present. That is the entire command.
Yeah,
just be
so
there.
Good. The second is understanding. Presence is the most important relational need people need who are suffering, but understanding is second. So when you show up, don't show up with answers, solutions. Show up with the ability to learn from their vantage point. What are they going through? Where are they at in their experience? What do they want to disclose and share with you in that moment? And then I think part of the wisdom of understanding is learning to listen. Learning to really sit and understand what a person is going through listening. Listening is the most important form of communication. The most common form of communication is talking. Like, we always want to talk. The best thing that you can do to somebody in pain is not talk a lot. Job's friends didn't talk for 2 verses and they comforted him. And then they talked for like 30-something chapters, and they made worse the situation for Job. Like,
Can I also say, with the desire to help, is also a willingness to make mistakes. You will not get this perfect. You're not a trained
true.
professional. Even trained professionals mess it up.
Yes,
I
we
remember
do.
I was doing my first couple of hospital visits and I learned some valuable lessons. You don't walk in the hospital and say, hey, how's everybody doing today? That's not the question that you want to ask or the energy that you want to bring into the room. So it's a learning process too.
Yeah, so true.
Yes.
And then the fourth one is love. Love is the foundational element that people desire in any human relationships, particularly in a moment of suffering or pain. You want to be loved. You want to be loved right where you're at. And I think that's what God does to us. God is love, but God loves us where we're at in moments of pain and suffering. And I think ultimately that's what people crave and need. Now, those are the primary approaches, but not the normal responses.
Okay.
The normal responses are what I call secondary approaches. Secondary approaches, some of them do have value. So when I share some of this, I'm not sharing it to say this doesn't have value, but it shouldn't be the primary response to a person in pain. Some of these are funny. If you laugh, that's okay. It's good to laugh. So here are secondary approaches that I have seen over the years, not only in my life, but particularly leading churches and people wanting to engage with hurting people within the framework of a church or Christianity. The first one is the teacher. The teacher wants you to be learning in your suffering. So they ask you questions like, what is God teaching you? Or what are you learning through this experience? To them, every experience of suffering is supposed to teach you a lesson. While it is true that that learning has value, that's not necessarily what somebody needs in a moment of pain or suffering. The second is the theologian. The theologian wants to explain theodicies, which is like reasons God allows suffering and evil. And they like to wax eloquent explaining the theological purposes behind suffering in this world. I would say rarely does a person desire that in a moment or a season of suffering. The third is the cheerleader. The cheerleader wants to cheer you up and paint an optimistic picture. They say things like, you got this, God is bigger than your suffering, or consider it joy what you are going through. This is interesting. They often secretly find pain and suffering uncomfortable. So they'll try to find a solution or an optimistic element for you because they don't want to sit in your pain with you. The next one is the healer. The healer wants you to be supernaturally immediately healed from your suffering. They bring faith, healing oil, and ideas about God as the great physician. What is often lacking in the healer is a wisdom to acknowledge that God may not heal that person of their pain and the awareness of the damage that false hope can do to a person spiritually. There are a lot of people in our lives that they're going to walk through a lifetime of a particular suffering. We don't want to paint an optimistic, supernatural, God's going to heal everybody picture because that's just not the reality for the majority. Think about being a pastor. Only a minority of people in our experience in ministry have ever been supernaturally healed.
Right.
The majority of people, they have to learn to navigate that with God and with community in a healthy way. Another one is the resourcer. The resourcer comes with books, blogs, and pamphlets. Everybody knows this person. They have content for you to read that will help you navigate what you're going through. While content is helpful at various points of suffering, content is not the dominant need. People need to know that. Another one is the influencer. The influencer wants you to see a bigger picture of how God may use your suffering. For them, suffering has a greater purpose, like winning people to Jesus or sharing your story to influence others. All of that may be true. However, a person suffering is usually not looking for some grand plan.
Right.
That's not their relational desire or need. That's not the soul longing that they have in that moment. Another one is the advice giver. The advice giver wants to help you resolve your suffering naturally and practically. They come with diet tips, medical advice, and essential oils. They have figured out how to help someone with your exact condition. They are the doctor you did not ask for, and they have the solutions to relieve your pain. What a lot of people don't understand is that oftentimes when a person is suffering, they will ask for the help that they need. They're already investigating and learning and going down different paths. They don't need 20 people in a community to come to them with different advice of how, they need to solve their exact problem. Most of the time, we don't actually know the inner longings or the consternation inside of a person who is suffering. And so the advice giver is not necessarily the wisest response to a person in pain. A couple more. The projector. The projector is insecure and uncomfortable around suffering, so they project their inner turmoil through talking a lot or quickly entering and exiting the situation. It is wise to evaluate your own inner fears, anxieties, discomforts, or insecurities around suffering. That way you can recognize them before you act out of them in a situation where a person needs you to be fully present in a non-anxious and caring manner. I feel like this is really important. Because projection happens a lot when we're relating to people who are suffering. We have our own inner dialogue that's happening. And really, I think maybe to deconstruct the intimidation a little bit, people just want you. And we sometimes provide the inciting of anxiety because we think we have to have some profound saying or solution. They just want you.
Yeah.
Like that's all they need. Just sit with them. Just be by their side. Just let them process at their own pace. And then the final one I find no value in, it's the judge. The judge is someone who thinks that there is a just reason why you are suffering. To them, you have done something wrong or you are living out a hidden reality that you're being judged for. They may ask you deep, probing moral questions or make comments like you reap what you sow. This approach to suffering is deeply damaging relationally, emotionally, mentally, and spiritually. And I would recommend stay clear from this approach. It happens far too often. This is what God rebuked Job's friends around. They had a wrong theology of suffering and they had a wrong theology of God. And so we should never look at somebody's suffering and say, there must be a reason behind this spiritually. You must have done something wrong. Stay clear of that. And I would just say my suggestion, and I'd love to hear from you guys after I've read that list, your response, but I would say go for the primary approaches every time. And wisely think through some of these secondary things that have value, but don't enter into the relationship with those secondary approaches.
It's very good. Very good.
So good. So good. I really appreciate you sharing all of those kind of different archetypes in a way because, I can imagine that all of us listening and even all of us talking right now can recognize some of our own tendencies when we're sitting with someone in pain. And so perhaps, a starting point as you listen to all of those different forms of responding is to think through, ask yourself this question. What urges do I feel to respond when someone's in pain? Do I have the tendency to kind of cover up the pain with my positivity? Do I have the tendency to look for all of the problems of the person in pain and to be critical? Kind of listening back over all of those different forms of responding, those secondary responses, and asking yourself the question, what fits with my tendencies? Because it may be a helpful process in just starting to build insight. And that secondary question that may be helpful to ask is, what's underlying that tendency? Like, what might I be afraid of? What am I uncomfortable with? How does that uncomfortability help or hurt me? And just get curious about your own natural dynamics in relationships, because oftentimes we come in wholeheartedly wanting to help. And when conversations or moments of vulnerability don't go the way that we planned, there's grief on the other side and confusion of, wait, that's not the outcome I wanted. That wasn't my intention. So maybe the starting place is getting curious, starting to build insight about yourself.
Yeah, I love that. What are your guys' thoughts?
Yeah, I mean, I think that your approach is reflective of what your relationship is with pain and what is your relationship with providing self-care to people. And I wonder if it's two approaches, to your point. just being curious about, okay, what's underlying that? Is there something along the lines, some belief system that has developed about myself or about pain that is motivating or influencing my tendency towards a particular approach? Also, it could be, what is it that, how is it that that approach has served me? Is it some way of, am I pulling from tools that I feel like it served me, and recognizing that it could be unique to you and helpful to you, and then again recognizing this person is an individual, and be curious about yourself, but be curious about them. I wonder what tools would be helpful to them or has been to them, and approaching them also with a curious mind.
Yeah. I think at the base level, just to demystify and de-intimidate this whole reality, people need the simple things.
Yes, yes,
Yeah.
they do.
Very much so.
Yeah.
So if we can equip you with just that thought, it's the simple things that are the most valuable and important when you're relating to somebody in pain and suffering. Go there every time, and you will do the right thing. And let's this is intimidating, and there are anxieties that we all feel, and there are inner things that we need to be curious about. But go for the basics, like we say in sports, the fundamentals.
Yeah.
That's the foundation that you build everything else upon. And the fundamentals, you got to stick to those in every area of life, and particularly in this area of connecting with people who are suffering. I'd love to transition this conversation from how can I help people who are processing through pain to how can I find help in my pain? You two are therapists and doctors, and I would love for you to answer a couple of questions. One, let's start here. What is therapy?
I can get us started. So therapy is, it takes many different forms. So it kind of depends on the therapist that you're working with. But therapy is provided typically by a licensed clinician. And that could be like a marriage and family therapist. That could be a licensed professional counselor. That could be a licensed social worker, a clinical psychologist. It could even be a psychiatrist. A lot of people don't know that. Some psychiatrists offer therapy. And then what you're going to expect is a talking style of therapy most often that is going to really be targeted towards treating the problems you're wanting help with. And the beautiful thing about it is if you find someone who is a good fit for you, you're finding someone with the specialty that meets your treatment needs or treatment goals. And what they're going to use is evidence-based practices. Therapy can sound so mystical. I know, we probably all have a picture in our mind of okay, so I walk into this room and it's all neutral colors, and I lay on a couch and there's a person with a sweater vest on. And that's the image that a lot of us have of therapy. And truthfully, it's for most people, it's not like that at all. You could meet with someone who looks similar to you or who looks different than you, who speaks in your language, and the tools they're going to help you with have been researched, and the tools they're going to use have been researched to actually alleviate the symptoms that you're experiencing. So therapy is more like a science applied in an art form to an individual's needs. And there are many different types of therapies that are utilized, but ultimately the important thing is that the therapy that's utilized within an individual is a good fit for them. Dr. Caine, what would you add to that?
Yeah, I would say that with people who are going through pain, going through a difficult time, and they have the members of their community, friends who approach them, and they make mistakes, right? And we were just talking about that. Therapy is an environment that's less risky than that. It is more of a secured space with somebody who's specifically trained in this area, where you can you can take the risk of saying really hard things that you might feel uncomfortable saying to other people, where you wonder, how will this complicate my relationship if I share this with a family member or a friend? Because there's this whole other relationship that you have to manage afterwards. Whereas in the therapeutic environment, the purpose is for you to say it, knowing that that is not going to complicate the relationship with your therapist, because your therapist is there for the purpose of hearing these types of things. So it's an opportunity there to take those risks, which could then alleviate some of the pressure that you may feel that come up for you with the other people in your lives, and allow there to be less of a need there, and maybe even some more grace, because people were just, talking about these. Some of these approaches are pretty funny, of what people will do to try to help, and you're receiving it, and it can be a very frustrating experience for you to know that you have this need and people are falling short. But if you have that need being met in a secured environment that gives you a higher rate of meeting your expectations, then you're more than likely to accept people for their limitations, and even be willing to communicate to them, no, that's not really what I'm looking for. What I'm looking for is this from you. And being able to still maintain those relationships, even if it starts off a little bit rocky. But the therapeutic process is an opportunity to take some risks.
Yeah. And the gift of it is that it's a completely confidential space as well.
Right.
So, all of these conversations that are more risky with people outside of that therapeutic relationship, that information could get shared with other people. But what you're talking about in a therapy session is protected both legally and ethically, will never be shared with anyone. And then you also have a very real relationship, a relationship with professional boundaries, but the therapy relationship is real. The person you're working with cares, and you build a dynamic. And this real relationship, the entire goal of it is helping you. And there's not really another place in most people's worlds where that's the case. Most of the time, the relationship, the goal is for both people to, experience health, for them to be this reciprocity. Therapy is different in that, you're really, really focused in on the challenges that you're working through, the pain you're trying to heal from, the treatment goals that you have. And that other person's entire focus and priority is your well-being.
When should a person see a therapist?
When you start noticing areas of your life are being impacted negatively, important areas of your life. So whether it's your family, friends, work, when you're seeing your ability to live, love, laugh, and work being impacted, and there's barriers related to that, that's when you should seek therapy.
Yeah, I couldn't agree more. I think through 4 different Ds when helping people assess whether it's a time for them to reach out for help or not. And the first one is distress. And that's really speaking to how much emotional pain is someone in? Are they slightly frustrated or disappointed on a day, or are they experiencing deep sadness or numbness or overwhelm, feeling very frightened or terrified? And then after distress, I'm looking at disruption. Are the thoughts they're having, the emotions they're having, the actions they're taking, what's occurring in their relationships, is it causing disruption in their life? And then I think through dysfunction, is the disruption and the distress that's occurring actually starting to interrupt what Dr. Caine said? My ability to live, to laugh, to love, are these important things to me now being blockaded, where I'm experiencing even more distress? I feel like I can't get my work done at the workplace. I feel like I'm not able to connect with my partner or my best friend. I notice myself isolating. And then the last piece is duration. How long has this been going on for? Is it, one really awful, horrible day? Or is this something that's been going on for 2 or 3 weeks? Because if we have the distress, if we have disruption, if we have dysfunction starting to happen and it's been going on for a while, that is a great indicator that it is time to ask for help and that you benefit from some additional support.
Yeah, those 4 Ds are really helpful. So there's a sea of therapists. I mean, if you Google, psychologist, counselor, therapist, it's overwhelming. How do you enter into that relationship? What are some tips? How do you find a good therapist that works for you?
Well, there are, practically speaking, there are websites that actually do that work where there's filters put in place. There are, and Dr. Casey mentioned a couple of episodes ago, Psychology Today is really popular. Good Therapy is really popular. Going through your insurance, if you're using insurance and getting a list of which therapists are within your network, those are ways that you could narrow down the sea of therapists that are available to you. One thing that I have to be honest with you, what's happening right now in time is the profession is being deeply impacted, which means the response rate to people who are seeking help is pretty longer than we'd like it to be. And there's a lot of work that's being done to get people trained and to get people who transfer to different states to become licensed quicker. There are things that the profession is trying to do to meet the need. But in the meantime, what I really want to say is be patient. Don't lose hope. Don't get discouraged. Plug through it. Even if there's a long response, keep reaching out to different therapists until you find one that gives a quicker response, because it really is going to be easy to get discouraged with the process. So I just want to be honest about what that experience is going to be like. But yeah, those are the tools that you can use. And then you actually get to ask yourself, what is it that you're looking for in a therapist? Well, who can you relate to and identify with? Is it, is there a particular gender, ethnicity? Certainly you want to look for people who have specific training in the area that you're needing assistance, whether it's grief or anxiety or depression, et cetera. There's specific training for all of these areas that therapists will actually indicate in their bios, so you know that they are trained in that area. You want to make sure the person is licensed. There's a lot of people who are providing care but aren't necessarily licensed or trained in that area, so you want to be careful with that. And then I also want to acknowledge another barrier, which is the financial barrier that can come into place. It can be quite expensive to seek therapy. However, there are resources, there are community organizations that exist in the area that provide either financial support or a sliding scale or something according to whatever resources you have available.
Yeah. Thinking about finding resources, I echo the empathy for anyone who's reaching out for help right now and having a hard time because our industry is so impacted currently. A few additional resources that I would share are, if sliding scale is something that you're interested in, community mental health centers are a great place to reach out to. And then additionally, I believe there is a resource called Open Path, and that is a website, and it's specifically has profiles of clinicians who offer sliding scale spots. It's trying to make therapy more accessible for people. And when it comes to insurance, if you're looking for someone in coverage, you can call the number on the back of your insurance card. Additionally, there are two different larger platforms if you want to kind of look online at people's profiles. One is called Alma, one is called Headway. And using those two larger platforms, you can actually kind of look based on your insurance, who's a network for you, and kind of sift through therapist profiles and request free consultations, which not every therapist is going to offer, but many do, which is pretty great. It means, you could schedule 3 or 4 different free consultations, and during that time, ask them questions that are going to help you get a feel for, what's their personality like, what's their training, what's their specialty, like, do I feel comfortable with this person, so that you feel the sense that you're making an informed choice about your care. Some questions that may be helpful to ask is, you can ask about their theoretical approach. You can ask, how am I going to know if I'm making progress? You can ask, what type of coping skills do they use if you're really wanting anxiety help or you're really wanting help with depression. If it's trauma work, there's a variety of trauma therapies. So it may benefit you to kind of look into different trauma treatments and then ask the therapist what treatments they're choosing to use. Make sure it's aligned with what you're wanting for yourself. For example, some people really want treatment through an approach called EMDR. So it may be helpful to look for someone who offers that specific approach. But those questions are a few examples. There are many others that we could talk about. If you're looking to find a help for your child, it'd be really helpful to ask the therapist, to what degree do you involve parents and how will you involve us, to make sure that's aligned with the values of your family. Yeah.
Very good.
This is really helpful. I believe we all have seen therapists.
Yes.
And therapy for me, at a point in my life when I needed to work through a lot of my childhood trauma, was instrumental in my healing process. I am so grateful for my therapist. And so we value the work you guys do. We're so thankful to be on this podcast with you. I know you're married, but I'm just on a level of helping people. God gifts people to help people, and God has gifted both of you, and we so value the work you do, and we so value the profession. And Better Days is pro therapy, and we believe that God can use it to bring deep healing and transformation and help to a person's life. So if you're at a point where some of those 4Ds or some of the explanation that you gave as well, where you realize that you need to seek out therapy for yourself, it is good, it is healthy, and it can be life-changing. And we encourage you to take that next step and find a therapist that works for you. And that may mean, a few consultations like you talked about, but it literally, from my personal story, can change your life. And we're thankful that God gives people to help people. Well, this is the end of this episode. So grateful that you joined us today, believing for better days ahead for you.